iPrevent viewers, this month is National Hepatitis Month. If you're familiar with iPrevent, you know that we oftentimes talk about Hep C and that we offer free HIV and Hep C testing regularly. Since it's National Hepatitis Awareness Month, let's dive into all the forms of viral hepatitis and its prevention. Hepatitis is an inflammation of the liver. Hepatitis can naturally subside or it can lead to more harsh conditions such as fibrosis, which is scarring, cirrhosis, which is disease that thickens the liver, or liver cancer. There are 5 main hepatitis virus strains referred to as types A, B, C, D, and E. Hepatitis A virus, HAV, is present in the feces of an individual with Hep A. It is most often transmitted through consumption of water or food that has been contaminated with fecal matter. Safe and effective vaccines are available to prevent HAV. Symptoms include fatigue, nausea, diarrhea, vomiting, and dark urine. Next, hepatitis B virus, HBV, is transmitted through exposure to blood, semen, and other bodily fluids. HBV can be transmitted from mothers with the virus to infants at the time of birth or from family members to an infant in early childhood. HBV is also commonly spread by exposure to bodily fluids through sexual contact. Vaccines are available to prevent HBV, and symptoms include fatigue, loss of appetite, yellow skin, and eyes. The next strain is hepatitis C virus, or HCV. It is mostly transmitted through exposure to infected blood. Transmission is often caused by contact with contaminated blood and sharing injection equipment. There is no vaccine for hepatitis C. There are no symptoms associated with Hep C, which is why it is often referred to as the silent killer. Hepatitis D virus, HDV, infections only occur in those who are infected with HBV because it is considered an incomplete virus. It needs additional information from the HBV virus to make copies of itself and spread. And finally, hepatitis E virus, HEV. It's mostly transmitted through consumption of contaminated water or food. It's similar to Hep A in the method of transmission, but occurs most often in East and South Asia. Hepatitis A, B, and C are most commonly transmitted in the U.S., with hepatitis A and B being the most commonly diagnosed in 2017 with 3,366 and 3,409 cases, and hepatitis C with 3,216 cases. While some form of hepatitis have symptoms, it is more common for no symptoms to appear in persons that have hepatitis, which is why it is so important to get tested regularly. In the New Orleans community, concerns with hepatitis A and hepatitis C lie within homelessness and those that use injection equipment for recreational use. This is because within those populations, there is less access to clean water and soap needed to kill germs and other bacteria. Sometimes, people share needles that put them at higher risk for contracting viral hepatitis, specifically hepatitis C, which can stay on surfaces for up to several hours to several days. So how can you take an active role in viral hepatitis prevention? There are steps that you can take to prevent the most common hepatitis complexes, A, B, C. In regards to hepatitis A, you can make sure you actively wash your hands for 20 seconds after touching surfaces, and do not touch your face. If you want to take part in helping the homeless population with sanitation needs, travel size hand sanitizer is a great option to include in a care package. There is also a vaccine available that is recommended by the CDC that you can get as a baby, but you can still get it at any time. For hepatitis B, be careful when you come in contact with bodily fluids. If you are a healthcare worker or an essential worker, make sure you use personal protection equipment such as masks and gloves. During sexual contact, methods of reducing your risk can be using condoms or dental dams as a barrier to bodily fluids. Similarly to hepatitis A, hepatitis B also has a vaccine. It is recommended to be administered in 3 rounds, with a 3rd round being administered 6 months after the first round. Hepatitis C is very contagious and it has no vaccine. also rarely has symptoms, so we recommend everyone get regularly tested. An estimated of 2.4 million people in the United States are living with hepatitis C. There are treatment options for those who are living with hepatitis C. It is important to protect yourself from blood and blood products using gloves and masks and other personal protection equipment. To avoid transmission via injection equipment, always use unused syringes, alcohol pads, gauze, and other equipment that is unused, such as piercing needles and tattoo needles. A resource you can use is the New Orleans area OHL Prevention Department's Safer Syringe Access and Safe Disposal Program. You can also receive free HIV and Hep C testing. OHL's community clinic has a team that can give you comprehensive care, including lab-based testing and various treatment options available. The Louisiana Department of Health also has a commitment to having a Hep C-free Louisiana. Since July 15, 2019, 3,893 people have been treated for Hep C in Louisiana, with 256 of those being between the ages of 18 and 29. Give us a call at 504-418-4955. So, iPrevent viewers, those are the main types of hepatitis and how to actively participate in prevention of the hepatitis transmission. If you are in the New Orleans community, you can always count on iPrevent and OHL as a resource. We offer free HIV and Hep C testing with follow-up care, clinic appointments for treatment for viral hepatitis, and we can provide you with unused needles and other injection equipment such as alcohol pads and gauze. We also offer safe disposal of needles and Dispose RX package. And we are a 24/7 resource for health information on social media. Hope you're staying safe and sanitized. Look out for our new community events in June at iprevent.org by clicking on our calendar. Until next